how's it going today?
Good.
Good?
Yeah.
Nice to see you again here
Thank
to the
you.
second session of the treatment session. So, how do you feel about it before we start?
I feel good. Yeah, nice to be here again, I think.
How's your mood today?
Good.
Nice to
Yeah.
hear that. So, as you know, that this is the second session that we meet each other again, and just for the quick review, that we've done some kind of examination previous session with each other, which means I gave you the result of the examination. So, and also that one of your question was that where is this pain exactly? Where is that come from? This pain, why is not go away? And yeah, during the you wanted also walking without the pain with your dog. So far, if you wanted to add something, if you change anything, just let me know if changing. Okay. Okay. So if you are ready, I will start from the session that what is the pain and where is that pain come from in your body. If you agree with that, we can start it. But before that, I wanted to ask, what do you know about the pain? Like, what is your feeling about the pain? What do you know? Where does that come from? Why you come from? Actually,
I don't know. Basically, this pain was like, I'm dealing with this pain for several years.
Yeah.
Yeah. After MRI and everything were done, but this pain is always there. My back and my core. It's just something I have to feel it. Yeah, that's it.
Okay. So the only things that you know about the pain is this one. Have you ever?
Maybe damage to my back. Low back is damaged.
You mean that pain is damaged?
Yeah. Yeah, that's the word they use, tear and the things.
Yeah.
Yeah.
Okay. Okay. I've already made a PowerPoint, some kind of presentation about the pain for you to. I think it is nice and give you a clear overview where is that pain come from, what is that pain exactly. So I will show you that we can see and go through it, this pain, this PowerPoint, sorry, and we can discover with each other what is this pain exactly and how can you deal and cope with this pain. What is the way? And yeah, this kind of things.
Sounds
That
good.
will, yeah. Okay. As you can see here, that there's a man, no man, I don't care this which one, which gender is that, but I will feel a lot of pain. But what is that pain exactly? Pain is an unpleasant sensory and emotional experience that could be get worse with some kind of personal experience, a bad personal experience. So far means that pain is not damage, you know. So sometimes people have a different mindset and sometimes in a wrong mindset that yeah, pain isn't damage, but it's not actually. It's completely understandable that it's an unpleasant sensory and emotional experience, and sometimes in some level of your tissue could be happen the injury, which we call it as acute pain. That I will go through this pain for the next slide. If I wanted to tell how many type of pain do we have, it's two pain. It's acute and chronic pain. What is the acute pain exactly? Acute pain is sometimes happen to response to possible injury, like a damage to part of your body. Everybody, I think, in the world of at least experience one time in their life that's break and or burning their hands. So those kind of pain is acute pain. So it's just come sharp and it's happen temporary and usually it just takes 3 months to 6 months, not further, and is an aching and also warning signal to the body, and it could be sharp, troubling, burning, and some kind of tingling. But this is not pain that you haven't. I just wanted to give you an overview of this
okay.
pain. The pain that you have is the next slide, which we call a chronic pain. What is a chronic pain? If some pain happened to your body and it takes more than 3 months, actually it's better to say that more than 6 months, that would be turned to the chronic pain. So, as the name suggests, this chronic pain could be constant or comes and go. So it depends on your mood, actually could be affected, get worse or get a little bit release and decrease it. And it sometimes is often described as a shooting pain, but yeah, it could be also impact significantly your daily life and some kind of, as I mentioned before, some kind of psychological problem like stress could be also the increase, and also anxiety could be increase your pain. And as you can see that here, one of the problem that it turns to the chronic pain is a lower back pain that you have it now. And like if I wanted to explain it more about what is happening exactly in your body, I can so far tell that the nervous system gets so much sensitive. What does that mean by that? How can I make it simple for you? Imagine your body is like a alarm system, like a home alarm system, that when somebody breaks a window or open the door, the alarm goes off to warn you something is wrong. And also exactly your body and brain works like that alarm system. If you cut your finger or sprain your ankle, the pain is the alarm telling you that something is injured. Be careful or protect it. And normally, once the problem is fixed, the alarm turns off.
Okay.
But with chronic pain, the alarm system becomes too sensitive. Even with the blowing window, when the window is already repaired, or also blowing the wind could be as sensitive and like make an alarm for you. And so nothing is new, and nothing new is damaging in your body. So it's just a little bit sensitive, your body actually.
Yeah.
But how pain travel in your body, I can say that if you see this is a brain here that has 4 major parts in your brain. When the pain happens in your body, at the end of the nervous system, there is a neurotransmitter that they are transfer the message through your spinal cord to your brain. So when the message comes from to your brain, first go to the control center, and then spread to the 3 parts of your brain. One part tell that there is a pain, the other feel the others actually react that how this pain feel, and the other decided to what to do with this pain. And but this is not the end of the story. If I wanted to tell you more, if you consider you have a nerve gate in your body, that your message of the pain should go through of this nerve gate. Actually I can say that the wide nerve gate open, the more pain that you feel, and also the nerve gate close it, the less pain you feel. But what does that mean? What keeps the gate open and what keeps the gate closed? Let's say for the next slide. What do you think? What do you think that what keeps your nerve open and what keeps your nerve gate closed?
I don't know.
Okay, I will tell you that. Discouraging thought and also encouraging thought. Like a good mood, or you'll be active, and also being happy could be encouraging, like encouraging thought. Definitely, act like a hormone and like a painkiller signal to your brain, and also they create the encouraging sudden feeling that overpower the bad ones. You know what I mean? So always being positive is really nice. But if you have a discouraging thought here about your pain, believing that if you move, your pain is gonna go like worse, or a stressful feeling and something like that, definitely it's gonna be affect your pain, and your pain gonna be increase. So far, encouraging stuff and discouraging stuff. But the good news is you can control your pain. I mean, pain is not gonna lead you to other like different pain. You're gonna lead your pain. What does that mean? I mean, you can do everything that you want, even with pain, but and also you can think so much to rewire your brain and change your life. But definitely just take a time and need practice, and yeah, just focus. Those three important elements is really important to like how deal with the pain. But how can I manage the pain? Encouraging thought, discouraging thought, plus staying active, and motion is lotion. You know what I mean? And healthy nutrition, that is really important, and good sleep, stress management, and also how can you manage your stress? Definitely, there is a lot of technique like a relaxation technique and something like that. That if you want, we can do it for the future. And those kind of elements, that's it's really important and helpful for you to manage your pain. So yeah, this is the end of this explaining to the pain, but I will definitely send this PowerPoint to you to you can review it again. But so far, if you have any question about the pain, just ask it.
No, I think it was a good information you gave me, explanation. But yes, of course, because there was a lot of words and things,
yeah.
So I'm curious to learn it. I mean, to read it, go through it, to see.
Yeah, definitely. Yeah, definitely. I will send it to you through email, WhatsApp. Which one is really handy for you? I will do it, and to just read more about it. But beside the pain education that I done, treatment and activity is one of the important part that I already mentioned that. But this time we're gonna share our decision together, like with you. I mean, I've already seen that you have also a mild COPD, which is definitely like influencing your physical capacity, and also based on the examination that we've done, I see also you have a little bit less strength in your lower extremity. So here we have two options if you accept this one, but you can, because our time is limited a little bit, but you can choose one of them if you want. One of them we can start with the strength training of the lower back, and the other is working on your physical capacity, which means aerobic training on your because of the COPD problem. Which one do you prefer?
Which one is better for me, you say?
Based on things, I think we can. If you ask my my advice, I can say that the strength training is better.
Yeah, because I wanted to tell you, as I mentioned before, I don't have there is a limitation about my COPD situation.
Okay.
I think a strength training, because you said it's good for my leg. I want to walk good with my body.
Perfect.
Then that one is good for me.
So okay, we deal with that.
Yeah.
Okay. Next step, let me clarify something to you. That based on your problem and the goal that you want to achieve in the future, definitely we should make a short-term goal and long-term goal based on your problem that you have in your treatment session. Which means that the short-term goal could be in the 4 weeks, 5 weeks, we can do a strength training of your lower extremity, and which means that okay, a strength training that would be really helpful for you to walking a little bit less painful without problem. And for the long term, you can be able to walking with your dog with the minimum problem that you have. It sounds good for you.
Yeah.
Good. And I know that I was really talkative today, but I would also mention which treatment approach that I will use it today.
Okay.
But definitely, if you are agree with this, we will go through on it. I will use it the treatment approach that we call it graded activity. Of course, there is a different like a training approach, but this one is more suitable for your problem. Which means that we will gradually increase your activity level step by step. And instead of like avoiding movements because of the pain, we slowly train the body to move again in a safe way, definitely. But how can we use it today? I consider as a strength training, the squat as a strength training. Why I choose the squat? Because a squat is like engage a different muscle, also your lower back and also your like buttock muscle, and also your thighs. So it's a combination of the muscles that we can work on it, which means it's really suitable again with your problem. For example, I just wanted to give an example. What is a graded activity exactly? We may start with a squat and which first we support your back and help you walk more comfortably. But step one, what is that? Starting level. First, we should find a comfortable starting point. We call it as a measurement instrument, that baseline, I mean. And like how many repetitions that you can do the squat. And then regular practice, definitely coming here and doing the practice 2 days a week is not enough. You know, you should take this responsibility if it's possible and do it in your free time for yourself. And then I will gradually increase the number of repetitions slowly. So yeah, this is the plan. If you have any question, just feel free. If you do not, we can start.
I think we can start.
Okay, good. Let's start. Is it possible to stand up and come here? Okay. Nice. Come here and then just grab the edge of the bed to move a little bit your hip to doing a little bit warm up. Okay.
Good.
Yeah, perfect. Good. Yeah. Change your leg. Good. Yeah, perfect. I just wanted to open your leg at the right of your shoulder. Yeah. And try to sit. I will stand with you. Don't worry. Like it's called. Do you know how can you do the squat? Yeah, by the way, okay. Just wanted to do a squat. Okay. Yeah, I can see that your knees just turn. Yeah. Internally a little bit. Is that possible? Do it again for me. Yeah. Okay. Okay. I will give a cue to just a little bit get rid of doing the internal rotation of your knee. This is not heavy, by the way. This is just like a cue to give you a good instruction to do the a squat. Whenever you wanted to sitting down, push your knee and adapt outwardly to maintain this bend at that place. Yeah, good.
Mhm.
1, I'm counting. 2, can you go further? Good. 3, do you have pain?
Nah. So it's not so many. I can do more.
4, 5, 6, how do you feel?
Good.
7,
I think I can do.
good.
One.
Yeah, I'm good. 8. Your baseline is 8, but I will calculate definitely. We will not like continuing with the 8 repetition. I will choose the 6th one, and then for the next time that you come here, we will gradually increase it. But you should continue it, and I will consider this one as a 1 set. And so
Yeah.
you have 2 more.
Okay.
So are you okay?
Yeah.
You can continue.
Mhm.
Nice. 1, 2, nice. 3, yeah. 4, 5, perfect. One more. Good. 30-second rest. How do you feel?
It's good.
Nice.
A bit difficult, I mean. But I think it's good. Yeah, it's happy.
Do you have a resistance band at home?
No, I don't have.
I will give you, because it's really need to do like put it this one in your the around of your knee to push it away and feel like prevent to do like internally rotation of your knee. Okay, are you ready for the last
Yeah.
one? Let's go. 1, good. 2, 3, 4, yeah, good. 5, one more. Perfect. Yeah, this time. Yeah, you can take a seat. Are you okay?
Yeah.
Good.
Yeah.
Good. Continue.
Good.
I will give you this resistant band to you.
Thank
You
you
can
so
take
much.
it, and whenever if was possible for you, if it's possible for you in your free time, whenever you feel free, like feel better, but you should. It's better to do it every day, but it's okay if
Yeah.
you forget it. But it's better to do it every day in your home or your free time, whenever you want it. Every day just 1 time. And so what was the principle? Was the 3 sets and how many repetitions did you do? 6, true.
Yeah.
Yeah, okay. If you have any question, feel free. If you don't, I can see you next time.
Of course. No, thank you. Everything was good. Thank
Yeah.
you very much.
Nice to see you again, and
Yeah,
take care.
Thank you.